The following videos demonstrate how to operationalize patient-centered counseling about reproductive goals and contraceptive preferences using the PATH framework. This framework is a concrete set of open-ended questions and counseling skills designed to effectively engage with patients about their reproductive goals and, when appropriate, pre-pregnancy care, contraception, and infertility services. PATH is an acronym. The PA stands for parenting or pregnancy attitudes, the T for timing, and the H for how important it is to prevent pregnancy. PATH asks the following 3 questions. For the PA, do you think you might like to have children at some point? Or if the person's already had children, do you think you might like to have more children at some point? The T, when do you think that might be? And the H, how important is it to you to prevent pregnancy until then?
Hey, good afternoon. I'm Dr. Brian DeWitt. It says here that you're seeing me today for an STD check.
Brian makes no assumptions about Kennedy's relationship with the person he had sex with. He doesn't say your new partner or seeing someone new, since this could have been a one-time encounter.
The assistant tells me that you're interested in getting tested because you've been with someone new. Are you experiencing any symptoms?
No, I just want to be safe,
Brian validates and gives Kennedy positive feedback. Notice as the vignette continues how Brian points out positives and validates several more times.
Testing is a great way to take care of yourself and also to make sure that you're not transmitting anything to a new partner.
I try.
Well, if you're not experiencing any specific symptoms, then I can offer you a urine test for gonorrhea and chlamydia and a blood test for syphilis and HIV. Is there anything else that you wanted to discuss today?
No, not me. But I'm also here with this new girl I've been seeing. She's getting checked out too, and I'm hoping that she gets on birth control too.
It sounds like you're both invested in being healthy. What are you currently doing to prevent pregnancy?
Condoms. But that's why I'm hoping she gets on the birth control. My daughter, Kayla, comes from using condom or from not using a condom.
You're not the first to mention this kind of thing happening.
Brian paraphrases and seamlessly moves on to PATH. Brian makes no assumptions and still asks how important pregnancy prevention is to Kennedy, even though he has been clear he wants no more children, because someone can want no more children and still be happy if one comes along.
It sounds like you are not ready for another pregnancy, but are you thinking that you might like to have more kids at some point?
No. I'm done. Done. I mean, don't get me wrong. I love my children so much, but I don't want any more kids.
I hear you. So, given that, how important is it to you to prevent pregnancy?
Well, it's very important to me, but most of the birth control is for women. It's not like I can make her use it. It's not my body. If she wants to use birth control or not, it's her body. All I can do is go along with whatever it is she wants to do.
It sounds like you see the importance of honoring the choices of the women that you've been with. And, most of my male patients are frustrated that there aren't more birth control methods for men. And if it were available, I would prescribe you male birth control. But the science just isn't there yet.
Yeah, right. What's up with that?
I think it's like you said. We pay more attention to preventing pregnancy with women than we do with men, not realizing that men care about preventing pregnancy and being prepared for pregnancy too. Drug companies need to know that men want to use male birth control. In the meantime, I do think it's important that guys like yourself know more about women's birth control methods so that they can have a conversation with their partners. It's a couple's issue, not just a woman's issue.
Yeah. I get where you're coming from.
Brian introduces a visual aid that has been sitting on the table. Kennedy has already had a chance to look at it and start to formulate his thinking about contraception.
Did you get a chance while you were waiting to take a look at this chart? It shows the different methods of birth control and how well they work to prevent pregnancy. I'd be happy to explain any of them to you.
I saw that, yeah. But as you said, not much for men but condoms and just pulling out.
Well, has anyone ever talked to you about permanent contraception?
No. What's that? Like, birth control forever? No. I mean, unless you mean that thing where they tie guys' tubes.
Well, that's exactly what we're talking about.
Brian introduces the topic of vasectomy without assumptions. He replies to Kennedy with positive feedback plus validation, and he adds clarifying information rather than correcting him. He then asks a funny, therefore memorable, follow-up question. Phrases like, all juice, no seeds, can help Kennedy retain the information.
Vasectomy. It's a very safe and effective procedure that men can use to prevent pregnancy. And you're right, once you get it, you can forget it. It continues to work for the rest of your life.
That's a good deal. But doesn't that end up taking away a man's cum? And what about a dude's sex drive?
Those are excellent questions. A lot of men worry that vasectomy is going to affect their coming or their sex drive. Fortunately, vasectomy doesn't do either of those things. Or really, what would be the point of using it?
Right.
It actually blocks the sperm from getting into the cum. The way that I explain it, it's all juice, no seeds.
Brian asks, what questions do you have for me about vasectomy? Rather than, do you have any questions, which can discourage questions. In order to focus the conversation, he asks, what other questions do you have for me about vasectomy? Rather than just a blanket, what questions do you have?
So, what other questions do you have for me about vasectomy?